It was just amazing how many people just kind of came together, the power, the unity right there and then. That started the whole thing.
The people that we work with, the ill and the elderly, are just great. I can't imagine doing anything else with my life.
I want to stay in this community. My kids like the schools here, and it is very sad to see what can happen, and it's like, who's next?
I cannot imagine why it would be worth so many dollars and so much time and effort and attention just to stop the union.
Goldendale is the 34th lowest paid, lowest benefited employee in the state. And that, I think, pretty much says it all. I mean, we're not last, but we are definitely not in the middle, and we're definitely not first.
He says, it's going to be a long haul, Barbara. It's going to be long and it's going to be hard. Just stick to it.
I'll see kids in the grocery store or something, and they'll say, you were there when I had my baby. You don't get that everywhere. There's a lot of satisfaction that comes with that.
We're a lot closer as a group. We know each other, more personable, and everybody's talking.
We're a family now, and we care for our patients like a family cares for their patients. I wanted to form a union to have a voice on the job and to not be afraid of losing my job just because somebody didn't like what I wore that day.
I was not even told a thank you, great job for what you have done. Thank you for keeping the kitchen running, for ordering all the food, for doing everything, not even a thank you. So that is why I am straightforward to this union, and we will have a contract.
When we've passed out our surveys to our coworkers, unanimously, almost, they've come back, you know, respect and a voice on the job was the #1 priorities.
The main reason for joining the union was job security. Once the corporate brim came in, you know, we just saw people left and right, you know, fired, losing their jobs, and I had an issue with that. You know, it was any time that I could lose my job also.
We were overworked, understaffed. I come home at night just dragging. I had no life. Then, with my husband not working and the low wages, I had to take on 2 other jobs.
When the management of the place treats the staff with respect and values them and supports them, they are rewarded with tremendous devotion and commitment and extra energy and interest in making things as good as they can be and having good ideas. And you know, the payback is tremendous for that kind of good treatment. And the converse is also true.
Our nurses that have been here a long time weren't able to have a say in the type of patient care that they were going to give. When they would bring it to the attention of the management, they felt like they were they were talking to a brick wall because nobody would listen.
We feel that the people in the whole county deserve to have county-based home health and hospice services. However, recently, the administration of the hospital has told us that we have to cut down our service area. They say that we can only go 50 miles from Goldendale. Not one of us likes this idea.
We were told that if we were seen sitting out there in the assisted living dining room, that we would be fired on the spot.
And we miss that, and the residents miss that, visiting with the girls in the kitchen. They loved it.
And it's very sad.
And they're taking it personal. They think maybe, you know, maybe it's something they did, and it's not. It's just management saying no more.
I don't even know how to describe it. It's like being in a school with a bad headmistress, you know, who's just mean. I'm sorry, I prefer to use, diplomatic language when I can, but that's the way it strikes me.
I've seen some tactics being done by administration that I didn't agree with and couldn't believe that somebody I had known and thought I had known quite well would choose to take an action so drastic against another employee, and I thought that was very out of character for that person.
I heard one person say at a public meeting that their life isn't perfect, their job isn't perfect, and basically we should just suck it up. Those of us that are here have done a pretty darn good job of sucking it up. We have been sucking it up through the really hard times. You know, we stayed with that hospital during the hard times. You suck it up for things that can't be changed. You shouldn't suck it up for things that need to be changed.